It's basically a virtual learning community.
Project ECHO is a case-based learning program solving real problems in real time. It turns into a learning community very quickly.
There are opportunities where a case is presented and people get to talk about the case and ask questions and look for recommendations. So it's a really great time where different people get to collaborate.
Specialty care is extremely hard to come by, but Project ECHO really helps leverage technology in order to effectively train primary care providers to handle less complex pediatric mental health issues locally within their own communities. This peer-based learning model, which is, I'll teach, I'll learn, really helps to address those gaps.
And when we're talking about a specific case, a specific patient, and all these providers from throughout the state offering support to the provider who's brought that case forward, and the validation that is given, it really is very powerful and meaningful.
I've been a big fan of the ECHO for a while for rural providers to be able to connect with specialists and also colleagues. Even if you're not in a rural part of the state, but you might be working in a practice that you don't have opportunity to have a conversation with a colleague, the ECHO provides that.
The more that people learn about ECHO, the more people come. And then, also another thing I've noticed is they share a lot amongst each other now.
The meat of this program lies in the relationships we've built and the kind of trust we have with each other about being able to manage things together. Psychiatry and primary care used to be extremely siloed. And so being able to have this program and actually have communication with people to take care of people is the most important part this program has provided.
What you sort of learn in this, especially in the ECHOs, is that we are all struggling with the same types of challenges. While the communities may be different, the school systems may be different, the family units may be different, there are so many consistencies between the kids that we are all really trying to support and struggling to do so. The cases that I've presented, are some of the most complicated cases that I take care of.
I think the ECHO model works because it's interdisciplinary. So someone can bring in a case, and regardless of what's going on in that case in terms of medical complexity, in terms of psychiatric or behavioral complexity, there's experts from all across the field. So what I found really amazing about the ECHOs is that there's always an answer to every question. And if there's not a direct answer, there's someone who knows someone who can ask, right? So it's building a network of people to help treat these really sophisticated cases in a very holistic way, which I think is amazing.
They now have more people that they know they can reach out to, even outside of the ECHO sessions. There's also that kind of validation that comes with it too, of knowing that this isn't just one person who's struggling with one patient. These are struggles that everyone's seeing across the system.
So I keep coming back because it's always valuable to attend these sessions. It's valuable when I'm the case presenter. It's valuable when I'm not the case presenter, but I can learn from the experiences of others and sort of the recommendations that they get, because we all deal with similar issues. It's also been so wonderful seeing that I'm not the only one struggling with what to do in scenarios that just seem sort of hopeless, or that we're all going through this together around the state, so you don't feel as isolated.
The other thing that I've noticed myself changing is I feel more confident and comfortable because I know I have a network that I can lean on if things feel confusing, right? So instead of kind of fumbling around in the dark, I can dance in the dark.
We are giving our providers the tools they need to make life better for the young people, children, teens, young people in Maine, by being able to help our providers in the moment to meet their healthcare needs, which for young people today are pretty significant. And it's really good to be in that community. And I feel like the ECHO provides information, increasing our knowledge base, but then also builds a community. So we sort of get all of those pieces from the ECHO, which is really showing to improve job satisfaction for providers, as well as increasing our knowledge so we can help our patients.
We all become experts the more we do, and kind of giving that back feels really important.